Remember, you cannot pass NCLEX without knowing your vocabulary. So today we're going to be going over words like rhabdomyolysis, lactase, and lithotripsy. Stay tuned as we go through these questions together. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, and I'm so glad you have joined us for our last video on suffixes. Remember, the vocabulary is critical in order for you to be able to pass NCLEX. And the Blue Book, which is published by Mark Clinic, I don't make any money off of it, sold by Amazon. You can get it on Amazon. Go to the Mark Clinic Blue Book. It focuses on vocabulary. So what we're doing is I'm basically putting vocabulary words into questions, and we're reviewing those so that you can see how to use these words and how they could be presented to you in the NCLEX, on the NCLEX. So if you haven't, I do recommend watching the first 3 of these suffix videos. You can watch everything so far that I've done related to the Blue Book, and Mark Clinic has done a few of these Blue Book lectures as well that you can have access to. So let's go ahead and get started. Here we go. The nurse is educating a patient about their newly diagnosed lipoma. Which statement by the patient indicates a correct understanding of the condition? Lipomas are a form of cancer that spreads quickly. A lipoma is a benign tumor made up of fat cells. Lipomas always require surgical removal, and lipomas are caused by a viral infection. So the suffix is oma, and oma means tumor. Now, tumor does not mean it's cancerous, and it doesn't mean it's not cancerous. Tumor is an abnormal cell growth. Okay, it's an abnormal growth somewhere that you normally wouldn't have. So the question is this malignant or benign? The reality is that most omas are benign, y'all. Most of them are. And for the most part, not always, but for the most part, they're going to give you an indication of whether it is benign or cancerous, okay? So the key thing here that I would use to answer this question is they didn't say it was malignant. They did not say it was malignant. Now, the reality is that lipomas are benign, okay? If it's not benign, it's not a lipoma. So you can memorize that if you want to, but I also want you to notice that they gave us no indication here in any way that this was a cancerous tumor. And it's a fat tumor, okay? LIP is the prefix that usually goes along with fat. So we've got a fat tumor, and the one that goes with that is B. A lipoma is a benign tumor made up of fat cells. That's the one that is most consistent with what we know about the ending of oma, the suffix of oma, and the prefix of LIP. So we're going to go ahead and pick B. Do they require surgical removal? Depends on how big they are, depends on how it's bothering the patient. It can be surgically removed, but certainly not always. And they're not caused by a viral infection. And it would be presumptuous to assume that it's cancer. Even if you didn't know, honestly, even if you didn't know, because there's no indication that it's cancerous anywhere in the question, I would not have picked A. So that's a testing strategy, but the vocabulary word or the suffix is oma, which means tumor. So let's do one more of those. A patient with a glioma is scheduled for radiation therapy. Which side effects should the nurse educate the patient to monitor for during treatment? Now, I want you to notice this essentially tells you that it's cancerous because they're undergoing radiation. So they didn't say a malignant glioma, but they did say they're undergoing radiation. So you are allowed to assume now that this is probably cancerous or malignant. Let's see what the answers are. Hair loss in the treated area, severe diarrhea, increased urination, skin discoloration on the legs. So you do have to know what a glioma is really in order to answer this, because radiation therapy, I would cross off C for increased urination. I don't think radiation therapy, no matter where it is, would increase urination. But radiation therapy damages the areas that it goes through. So if you are having radiation to the GI tract, you could have constipation or diarrhea. If you're having radiation to the lower legs, you could have skin discoloration. So I'm not, right? So you kind of have to know. So just so you know, the GLI, so oma is tumor. It's a tumor somewhere. GLI is always associated with the nervous system. Okay, nervous system. So if you think nervous system and nerves, where would we think that this glioma would be? Well, it's actually a brain tumor. A glioma is a brain tumor. And so if you think about the brain, what would be the area that would be most likely affected that the radiation would be going through? What would be going through the hair, right? So you're going to have hair loss in the treated area. So as you do take your NCLEX, you need to think about the suffixes and the prefixes and be familiar at least with what a lot of these suffixes and prefixes refer to. So oma is tumor, GLI, G-L-I, is nervous system. All right, 3, the nurse is providing discharge instructions to a patient with a new cecostomy. Which statement should the nurse include to ensure proper care of the cecostomy site? Change the cecostomy bag once a week. Avoid all physical activity to prevent damage to the cecostomy. Only a healthcare provider should change cecostomy dressings or clean the stoma and surrounding skin with mild soap and water daily. So I like this question because it gives me an opportunity to not just teach you a suffix, but also to do a little bit of testing strategy with you. Ostomy. Ostomy is a surgically created hole or surgically created opening. Okay, so an ostomy is not a naturally occurring opening, just like a fistula. A fistula is an opening where you don't expect there to be an opening, but ostomy is a surgically created opening. So what's CEC? Cec, right? Cecostomy. Well, if you think of the cecum is in the GI tract. So we're saying, well, this is a surgical opening in the GI tract. So let's think about this. So we've got basically a stoma in the GI tract. So we've got a bag probably somewhere in the abdomen. And we know that the skin around it can be irritated by having things coming out of that area. Okay, so we go, all right, so that we kind of know that. So change the cecostomy bag once a week. Maybe. I don't know how often you're supposed to change it. Like, let's just say we don't know how often. Maybe. All right, so we'll leave that on as a question mark. B, avoid all physical activity. No. We never tell people to avoid all physical activity. Like that, we never do that. I'm crossing off B. C, only a healthcare provider should change cecostomy dressings. Well, we're sending them home. So I'm thinking that they're going to need to change the bag at home, right? So, okay, so I'm crossing off C. D, clean the stoma and surrounding skin with mild soap and water daily. So I know the skin can be irritated when someone has an abdominal stoma, right? An ileostomy, cecostomy, whatever, stomas in the abdomen can cause skin irritation. So let's say we don't know how often this bag is supposed to be changed. So I say, okay, this says which statement should the nurse include to ensure proper care of the cecostomy site. So it doesn't say best, but we're only allowed to choose one thing. So if we're only allowed to choose one thing, it's got to be the best answer out of all of these. Okay, so the best answer out of all these, what is best out of all these options? Well, I'm between A and D. Now, when I get between two, and I always go back and reread the question. So I'm like, well, it's not a first question. If it was a first question, I do this, and then I do this, or I do B, and then I do A. It's not a first question. So it's really a best. So I would say I can do one, but never do the other one. So A, I would change the cecostomy bag once a week, but I would not clean the stoma surrounding skin with mild soap and water daily. So I'm going to change it once a week, but I'm not going to clean the skin once a day. I really need to clean that skin, y'all. I really need to, because I know that's a big risk. So I'm going to clean the skin every day, but I'm not going to change the bag once a week. Well, that's fine. I mean, I could change the bag once a day. I could change the bag whenever it needs it. As long as I'm cleaning the skin around it, I can change the bag, I would think, as often as I needed to make sure that it doesn't smell bad and it doesn't have any holes in it and all that. Okay. So I'm going to pick D because I really have to clean the skin so that we don't have skin breakdown. Question 4, the nurse is educating a patient with a recent diagnosis of hemophilia about the importance of hemostasis. So no, we're not doing the prefix hemo, but we did do the prefix hemo in the prefixes blue book lecture, and hemo is blood. All right, which statement by the patient indicates a correct understanding of hemostasis? So the suffix here, stasis, means stop. Stop. Stasis is stop. So hemo is blood. Stasis is stop. So stopping of the blood. Which statement by the patient indicates a correct understanding of stopping blood? A, hemostasis is the process of breaking down blood clots in my body. B, hemostasis involves the formation of new red blood cells. C, hemostasis is the process that stops bleeding and prevents excessive blood loss. D, hemostasis refers to the balance of electrolytes in my bloodstream. Well, I hope you would cross off D no matter what, because hemo is blood. So I'm not going to pick an answer that has electrolytes in it. So anyway, if you know what the suffix means, you know what the answer is to this question. And remember, we're not particularly doing testing strategies with this lecture. We're doing vocabulary. And is it important to know vocabulary? I've said it is. And Mark has said, as long as I've known him, the number one reason people fail NCLEX is poor vocabulary. All right, question 5. A patient is admitted to the emergency department with suspected rhabdomyolysis. After an intense workout session, which of the following laboratory findings would the nurse expect to confirm the diagnosis of rhabdomyolysis? Elevated CK levels, low blood urea nitrogen levels, decreased serum potassium levels, or low creatinine levels. Lysis is the suffix we're working with here. Lysis means breakdown. Now, myo is muscle. So even if you don't know what rhabdo means, myo is muscle. So it's somehow the breakdown of muscle. Now, what it is it releases a protein or some kind of protein that can cause damage to the kidneys. And so we are watching for kidney damage, okay? And it can happen, it can happen after very intense and particularly anaerobic workout where people are lifting weights and they can cause enough muscle breakdown. So anyway, you can see it occur after very intense workouts. That's one of the reasons it can occur. So let's look and see if we have any kidney options here. Elevated serum creatinine kinase levels. That's not specific to the kidneys. Low blood urea nitrogen. So BUN is specific to the kidneys. It's also specific to hydration status, but it's specific to the kidneys. But we wouldn't expect it to be low. We'd expect it to be high if it causes kidney damage. So we're going to have to cross off B. Decreased serum potassium levels. Well, serum potassium isn't specific to the kidneys, but you can, with kidney damage, you can see elevated serum potassium levels. So I don't expect a decreased serum potassium level with kidney problems. Low creatinine levels. Well, that is specific to kidneys, but I expect it to be high. So B, C, and D, none of those are the right answers. So we better look at A, elevated serum creatinine kinase levels. So if you don't know this, before there was troponin is a cardiac enzyme that is elevated with cardiac muscle damage. You see an elevation in troponin. But before we started measuring troponin, we used to measure what's called the CKMB. CKMB is creatinine kinase MB, and I can't remember what MB stands for. It might be myoglobin. I don't know what it stands for. But CKMB was specific to cardiac muscle. So CKMB, you would see it, you still do see it elevated in angina, heart attack. Okay, so you see the CKMB elevated, and we don't measure it much anymore because it takes a long time for it to go up, and we've replaced it with the troponin. So the CK in and of itself is released, even if we don't look at the specific MB. CK is elevated with muscle damage. Any muscle damage anywhere in the body. Someone's in a traumatic car accident, they're going to have muscle damage because they'll have bruising, right? Any kind of bruising, you could potentially see the CK go up. Well, rhabdomyolysis is the breakdown of muscle. So wouldn't you expect to see the lab that indicates breakdown of muscle to go up when you have rhabdomyolysis? So that is the correct answer. So why did I bother to even talk about the kidneys to begin with? Because we do also have to watch for kidney damage, but the CK levels would definitely go up. Question 6, the nurse is reviewing a patient's laboratory results and notes an elevated lactate level. The nurse understands that this could be due to increased glycolysis under anaerobic conditions. Which condition might this finding suggest? Dehydration, hypoxia, hyperglycemia, or alkalosis. So which suffix am I using here? I'm still doing lysis. Lysis is the breakdown of something. Glycolysis, the breakdown of glucose. Okay, glycolysis, the breakdown of glucose. It's used for energy. Let's read this question again because I want you to understand all these words. The nurse is reviewing a patient's laboratory results and notes an elevated lactate level. The nurse understands that this could be due. So you don't have to wonder why. You don't have to go, well, what does that mean to have an elevated lactate level? No, it tells you right here. This could be due to increased glucose breakdown under anaerobic conditions. What does anaerobic mean? Aerobic means you're using energy in the presence of oxygen. Anaerobic means you're using energy without the presence of oxygen. That's what aerobic versus anaerobic means. So if we're having increased breakdown of glucose under anaerobic conditions, because you can have increased breakdown of glucose in aerobic conditions, or you can have the increased breakdown of glucose in anaerobic conditions, okay? So it's telling you it's in an anaerobic condition, not in the presence of oxygen. There's a low levels of oxygen available. So that's why it's anaerobic. So what does this finding suggest? Dehydration. Well, that's low fluid. Hypoxia. There's low oxygen. Hyperglycemia. That's increased glucose. Alkalosis. Alkalosis is pH. Anaerobic and pH are separate concepts. They can be related to each other, but they're separate concepts. So which one means low oxygen? Hypoxia means that. So what you need to be able to do is understand the vocabulary. Will you get a question like this on NCLEX? I don't know. You may not, but you still have to understand the vocabulary. And this is how you read a question, to understand the vocabulary and figure out the right answer based on the meaning of the words. 7, after undergoing lithotripsy, a patient is instructed to strain their urine. What is the primary reason for this post-procedure instruction? To monitor for signs of infection, to collect fragments of the broken stone for analysis, to ensure proper hydration, to check for blood in the urine. So lithotripsy, tripsy is the suffix, and it means the crushing of something by a surgical instrument. Tripsy means the crushing of something by a surgical instrument. So litho actually means stone. It actually means stone. It's a prefix that means stone. If you want to remember it, you can. Litho. So it's the breakdown of a stone. So where do we break down stones? We break them down in the kidneys, right? Kidney stones. They block urine. They cause a lot of pain. So they underwent a procedure where a surgical instrument broke up the stones in the kidney. A patient is instructed to strain their urine. What is the primary reason for this post-procedure instruction? Well, why straining the urine literally means straining the urine. If you've ever made noodles, you know that you strain them. You get a strainer out. You pour the noodles that are still in the water. You pour it over the strainer and you strain out the water, so you just have the noodles left. So if you're straining urine, you're straining out the water, and what do you have left? Well, anything that stays in there that's big enough to stay in the strainer. What would be big enough to stay in the strainer? The remaining stones. So the stones have been broken up, and so we're watching to see if we're going to release any of those stone fragments. So the correct answer is B. 8, a patient with cystic fibrosis is having difficulty absorbing fats from their diet. The nurse understands the deficiency in which enzyme is most likely contributing to this issue: amylase, lipase, lactase, or RNase. Okay, so ACE is the suffix. ACE is the ending that's attributed to enzyme. Anytime you see a word that ends in ASE, it's an enzyme. Okay, so basically what it's saying is these are all enzymes. Amylase, lipase, lactase, and RNase are all enzymes. So which one would be associated with fat breakdown? Remember, we had the word lipoma in the first question. So I'm testing whether you can remember the prefix that I taught you in question 1. I taught you lip is fat, right? Lipoma. So what do you think enzyme would be associated with fat digestion? It would be lipase. So there was a short and sweet video today. I hope that was helpful to you. If you're interested in taking one of our reviews, which is phenomenal NCLEX review, go to clinicreviews.com. This was our last suffix video, and for the rest of the week, I'll be doing other things other than the blue book, and then we'll get back to the blue book next week. So I hope you have a great rest of your day. Thanks.